Dr. Saul, we've been focusing on heart health and keeping our hearts healthy. You're a cardiologist with Intermountain at Logan Regional. Tell me a little bit about heart disease and, in a nutshell.
Well, it's probably best to think about what sorts of heart problems we see here at Cache Valley, in Cache Valley Heart Clinic. And there's several, we see the whole gamut, basically. Even though Cache Valley is relatively small compared to the Wasatch Front or large metropolitan areas, there's enough people in the valley that we really are presented with most of the problems you see in cardiology. And what we see in general groups are coronary artery disease, rhythm abnormalities, especially atrial fibrillation, people with congestive heart failure, and valvular heart disease. And those are sort of large groups, and we see lots of all of that. And we can deal with most of that here.
And what are some of the patients that come in here and see you for those?
What type of problems?
Yes.
Well,
we're talking about like heart attacks.
Yeah, in coronary disease, the typical people that we take care of here are people with chronic coronary disease, and they have angina, which is chest pain associated with their heart. We see the complications of coronary disease, like congestive heart failure. We also see initially at our hospital acute myocardial infarctions, and those are the people that are having an actual heart attack right as in progress. But they're mostly seen in the emergency room. The decision is made that they're having an acute heart attack, and they're transferred.
And where do they usually get transferred? We
usually transfer them. They need to go to a larger facility that has services that we don't have in Logan, and that is either interventional cardiology or cardiac surgery capabilities. And those hospitals are on the Wasatch Front. So McCady Hospital, Ogden Regional Hospital, LDS Hospital, Intermountain Medical Center down in Murray. Those are all major centers that can provide these services. So depending on various factors, they'll be sent to one of those hospitals. And usually we either send them by ambulance or by helicopter, depending on the severity of the problem. But those patients are treated in the emergency room initially and then immediately transferred.
So when is it a good time then to actually see a cardiologist? Is there a age or a specific family history maybe?
Well, I'd say the most pressing need is when you're having chest pain. And those are the issues that we see and that the emergency room physicians see. Mm-hmm. We see them in our clinic too. So there's acute chest pain, meaning it's just suddenly happening and you think you might be having a heart attack. Those patients need to go to the emergency room, and then we decide what's going on from there. Then we see a lot of people that have either had heart attacks in the past and need follow-up, or having problems with ongoing but stable chest pains, chronic angina. We see people with congestive heart failure, people that think they're short of breath, some kind of new shortness of breath, and we need to deal with that symptom and make sure they're not having problems with their heart. We see people with arrhythmias, especially, as I mentioned, atrial fibrillation. It's very common. It's probably the most common rhythm.
And for us folks that aren't quite as literate on that, what is that exactly?
Atrial fibrillation is a heart rhythm disturbance. As I mentioned, it's very common. It increases with age. It's associated with all those other categories of problems I mentioned, like coronary disease and valvular heart disease and congestive heart failure. It is a problem when the top part of the heart loses its organized beating and essentially quivers up there. We call it fibrillation. But the top part starts to quiver and the bottom part, in a sense, loses its direction. Usually it's beating too fast and irregular, and a lot of people will become symptomatic from that. So there's a lot of treatments for that we do. We can take care of medical therapy. There are other sorts of treatments that are not available here that we send to the tertiary care centers.
And I know you offer different things here like pacemakers, and do you also do stents and things like that?
We do pacemakers. The procedure that we provide here in Cache Valley, most of the diagnostic testing we do here. We do EKGs, stress testing of all sorts. We do diagnostic cardiac catheterizations. We do implant permanent pacemakers and temporary pacemakers, and we follow up pacemakers. This is a pacemaker programmer here. The things we don't do in Cache Valley require a larger center, tertiary care center, with usually with cardiac surgery, interventional cardiology, which is balloon angioplasty and placement of stents, is performed in larger centers. We plan to...
Yeah, the future, you may be planning on having some of that here offered in Cache Valley.
That's right. We're hoping, one of the reasons we joined Intermountain was to expand the program and get an interventional cardiologist here so that we can perform interventions, stenting and angioplasties right here in Logan. And we plan to have that available within the next 2 years.
And that will be great. That way everyone can stay in the valley. I know I have a grandfather that has to travel outside for his heart conditions, but what a great thing to offer here in the valley. And I thank you so much, Dr. Saul, for giving us your time and your expertise on heart disease and what we can do to help maybe prevent it or notice things about it.
Okay, you're welcome.
Thanks.